In this video, we are going to be doing the abdomen assessment and also pain assessment. In this assessment, I asked my patient to take off their shirt, but for privacy purposes, my patient is wearing a shirt. So the first thing that we like to do is ask the patient to lie on their back so that we could go ahead and do an inspection. So we look at the abdomen for contour, we look for symmetry, we look at the umbilicus, at the skin. We want to see if there's any pulsation or movement and if there's any hair distribution. So the next thing that I want to do is auscultate. We want to auscultate for the bowel sounds. So for this assessment, we want to start from the right lower quadrant and progress clockwise to the right upper quadrant, left upper quadrant, and then the left lower quadrant. The next thing we want to do is whenever we're auscultating, make sure that we note if there's any vascular sounds. Next, we move on to percussion. So we're going to go ahead and percuss all four quadrants. We're also going to percuss the border of the liver and the spleen. For this percussion, we make sure that we ask the patient to lift up their legs so that we're able to percuss properly, and also ask the patient to breathe in deeply so that we could go ahead and percuss the liver and the spleen. The next step would be to do palpation. So we're going to lightly palpate in all four quadrants. Again, following the same clockwise direction. We're going to start with light palpation, and then we're going to do a deep palpation in all four quadrants. Lastly, we want to palpate for the liver, the spleen, and the kidney. And again, for this, we like to ask the patient to lift up the legs. To bend the knees. We want to ask our patient to bend their knees. For the kidneys, we're going to try and palpate and we're not supposed to feel anything, which would be a normal finding. If we feel anything, that would be an abnormal finding. Now, the next thing we want to do is to ask our patient to move around and ask them if they have any pain. So firstly, before asking the patient, we want to look at them subjectively, see if they're showing any signs of pain. If they do, we could use the PQRSTU as a guide for pain assessment. P would stand for provoked, Q would stand for quality, R would stand for region, S for severity, and T for time. But in this case, the patient does not report any pain. Lastly, we want to ask the patient objectively and see if they are having any pain. We want to look for any nonverbal behaviors of pain and assess for any physiological changes in various body systems if they would report pain.